Good morning, Lindsay. My name is Joshua Geiger. I am a nurse practitioner, family nurse practitioner student from Saginaw Valley State University. How are you this morning?
Good.
Okay. This morning, what we're going to be performing is a musculoskeletal exam on you. Do you have any muscle pain, any bone pain, any arthritis, anything like that?
No.
Have you ever had any surgeries in the past?
No.
Okay. All right. And then I would have my hands washed, of course. I would note his general appearance, doesn't note to be in any distress, check her vital signs. All right. So first what I'm going to do is I'm going to inspect. We'll start with the upper extremities, just kind of looking at the shoulder girdle, kind of looking at the scapula. Real life scenario, she would be in a gown, which would make this a little bit easier. And while I'm looking at these structures, I'm going to see if there's any swelling, any fasciculations, any redness. I'm going to take a look at the joint spaces bilaterally as well. And then work my way down to her elbows. And I'll have you kind of flex your elbows kind of at a 90-degree angle at your side. And then I would note any abnormal contours, if there's any sort of deviation, redness, or swelling, anything that would indicate inflammation. I'm not noting anything bilaterally here. No elbow pain or anything?
No.
Okay, how about any wrist or hand pain?
No.
Okay, and then as I'm looking at her wrists and hands, I would note if there's any radial or ulnar deviation, any muscle atrophy, once again, any redness or swelling, and I do not know any at this time. Okay, so then now we're going to kind of palpate the upper extremities. So I'm going to do this bilaterally just for the sake of time. So I'm going to start at the sternoclavicular joint space, which is going to be right in the center here, and palpate out. The automaticromium process, palpate that, the thoracoid process, scapula kind of going around back here. And I'm going to grasp her humeral head on each side as well. No pain or anything. Thoracoid process as well, I'm not sure if I mentioned that. And then the greater tubercle, I'm going to palpate for the biceps tendon right here. Then I'm going to work my way down to her elbows here. I'm going to palpate medial and lateral epicondyles, olecranon process on each side, and then the ulnar nerve, which is going to be in between the medial epicondyle and the olecranon process. Palpate down the forearms, not noting any swelling, redness, once again, no nodules, anything like that. Now working our way to the hands, I'll do each hand individually, looking for the radial styloid process, the anatomic snuff box, palpating for any making kind of swelling, the carpals, metacarpals, and metacarpal phalangeal joints. I'm going to compress those each side bilaterally once again. Palpating, not palpating any nodules, anything abnormal at this time. So now what we're going to do is I'm going to have you do some range of motion tests with me. So we're going to do shoulders first and kind of work our way down the arm, kind of like the inspection and the palpation.
Okay.
All right, so first I'm going to have you put your arms above your head like this.
Okay.
Okay, now kind of back behind you. All right, and then I'm going to have you bring your arms up at your sides, back down. And we're going to do right arm, we're going to adduct it across your body. Very good. Now the opposite arm across your body. Very good. Now we're going to do an external rotation. I'm going to have you bend your arms about 90 degrees at the elbow and point them toward the ceiling if you can, best you can. All right, now reach behind the back, grab your scapula best you can.
Okay.
Okay, there's our internal rotation. So now we're going to move our way down to your elbows. I'm going to have you flex your elbows out. Now extend them. Okay. And then I'm going to have you, since we did that, I'm going to have you put your arm like this and just rotate. Okay. Now with your wrists, I'm going to have you flex them up. Now extend them back out. Now your thumb, I'm going to have you kind of flex it across, touch your pinky finger, and extend it back out, and then touch all your fingers. And make a fist, and then spread your hand, lay it out. Okay. So now we're going to do kind of a special type of test called, we're going to look for shoulder impingement here. So I'm going to put some pressure on the scapula here, and grab your arm. Maybe I'm going to press. Are you pain with this?
No.
Okay. And then we'll do the same thing on the left side. Press on the scapula, and up, out. Any pain?
No.
Okay, very good. All right. And then, so now what we're going to do is we're going to kind of take a look at your infraspinatus, so that's your spinatus. So I'm going to have you put your arms at your side, but have your thumbs up, kind of like this. All right, and then I'm going to press in on you. Okay, now press out. Okay, very good. And then now we're going to do is what's called forearm supination. So I'm going to have you make kind of a table shape with your arms. Okay. Yep. Right, very good. Any issue with that? Any pain?
No.
Okay. Now I'm going to have you we're going to do a drop arm test. I'm going to have you put your arms up at your side. I'll kind of lower them down slowly. Very good. Now we're going to do a couple tests that involve your hands a little bit more, called the Tinel test and the Phelan test. So the Tinel test, I'm going to do where your nerve will be around here. I'm going to tap it. Any discomfort?
No.
Okay. Okay. Now the Phelan test, I'm going to have you put your hands just kind of like this and flex them best you can. And you hold that for 30 seconds. If you're paying attention, if you have any difficulty doing that, if there was any sort of burning sensation, which could be indicative of a carpal tunnel issue. Okay. So that kind of concludes the upper extremity examination. So moving to the lower extremities, what I would do is I would observe hip, knee, kind of ankle, foot area. Looking at the hip, I'll look posterior and anterior, seeing if there is any bruising, deformity, swelling. Working my way down to the knees, I'll look to see once again if there is any deformity, swelling. I'll look at the contour of the knee. Then I'll look at the quadricep muscle as well, noting if there's any atrophy or abnormalities there. And then working my way down to the foot and the ankle. Once again, noting if there's any swelling, redness, inflammation, nodules, if there is any calluses or corns, which I am not seeing at this time. Do you ever have any issues with your feet, Lindsay?
No.
Okay, very good. So after the inspection portion of the lower extremities, what I'm going to have you do now, Lindsay, is I'm going to have you stand up, and then I guess stand here and then kind of walk this way.
Okay.
So then we're just going to observe for our patient's gait, noting if there's any shifting of the pelvis, kind of the positioning of the knees, if they bow in or out. And Lindsay does not appear to have any issues with her gait at this time. Okay, so actually, I guess if you want to keep standing up, so we are going to do some palpation now after we observe for the gait. So we're going to look for the anterior superior iliac spine, the posterior superior iliac spine. I'm going to palpate the greater trochanter as well. And while we're doing this, we're going to be seeing if there's any pain or discomfort on part of the patient. So we'll do the anterior superior iliac spine first, which would be kind of this area right here. Posterior, be back here. Maybe kind of looking for dimpling as well. Some patients may have dimpling that could help us with our landmarks a little better. And then right here, greater trochanter. Is there any pain in any of those areas, Lindsay? Okay, and then once again, this would be performed bilaterally as well. So from there, what we're going to do is then palpate quads. If there's any pain, discomfort, Lindsay?
No.
Okay, now I'll have you sit back down, and then I'm going to kind of take a look at your knee. Okay, and we can position this a little better so we can see the knee here. All right, so if I can put the patellar tendon, any tenderness when I do this, Lindsay?
No.
Okay, and then Going around the outside for the tibial-femoral joint. Tibial plateau, which is going to be a flatter surface kind of on the anterior portion, chin area. Medial and lateral on each portion of the knee, any discomfort. Okay. And then the suprapatellar area as well. It's going to be kind of right here. Any discomfort?
No.
Okay, and then one thing, I guess I'll have you straighten one leg out. I'll kind of explain how this would happen. So a special test we could do is called the bulge test. So what I would do for that is I would lateral aspect of her leg, kind of, or yeah, laying down to try to make it a little bit easier. Okay. Working my way up to kind of the lateral aspect of her knee here, pushing any fluid. Oh, sorry, reverse order. Medial aspect of the knee, working my way up, pushing any fluid. And then laterally pushing fluid down and kind of doing a tap. And I would note usually if there was any shifting of fluid that I noticed, or some patients that a bulge essentially, which is what they call it, the bulge test. And then another thing we could do, another test to see if there's like a major joint effusion or anything like that occurring, is kind of press in the suprapatellar area against the femur, just to see if there's any displacement of fluid while I do that, and that would indicate kind of a larger type of effusion that would be occurring. On Lindsay, I'm not palpating any of those, or palpating anything that would indicate an effusion. So that is all normal finding. So kind of working our way down to the ankle now. Palpate ankle foot. If there's any bogginess, any pain or discomfort,
No.
Gonna palpate the Achilles tendons bilaterally. If there's any nodules, the calcaneus, as well as the plantar fascia. Discomfort, Lindsay?
No.
Okay. Right. And then we're gonna kind of work our way down to the bones of our lower foot, kind of our tarsals and our metatarsals. Any pain with that, Lindsay?
No.
Okay, very good. So now what we're going to do is we're going to move on to range of motion with our lower extremities. So I'm going to have you kind of lay on your back again,
Okay.
in a supine position.
Okay.
We'll do each leg individually. I'll have you bring your right leg first up towards your stomach. Very good. Now the left leg. Very good. So it'll be hip flexion we're testing. Now I'll have you go to a prone position on your stomach. And I'll essentially kind of have you bring your calcaneus, kind of bring it up to your buttocks. All right, now the opposite leg. Very good. Any issue with any of that?
No.
Okay, no pain, discomfort, always a good sign. So now we're going to do abduction, adduction.
Stay lying down.
Yep.
Okay.
Supine position. So what we're going to do is I'm going to have you take your right leg up in the air and then kind of bring it across your body to the left. Okay, now bring it out towards me. Very good. Now we'll do the same thing with the opposite leg.
Okay.
Right. Now out. Very good. So now I'm going to kind of show you what I want you to do, then I'm going to have you do it on your own.
Okay.
I'm going to have you do kind of an internal rotation and an external rotation. Go like this. And do that.
Okay.
With each leg. All right. Now I'm going to have you come back up to a sitting position. So I'm going to have you kind of extend each knee out like that. Not kind of hard. You don't have a table. Very good. Now I'll have you stand up and kind of just do kind of a couple of kind of squat type motions standing in place.
Okay.
Okay, now I'll have you sit back down. So what I'm going to do is I'm going to do kind of an internal, external rotation. And testing knee. I'm going to grab your calcaneus and then rotate externally, internally. Any pain when I do that?
No.
Okay. Very good. Now I'll have you return back to a standing position. And what I'm going to have you do is I'll have you walk towards the window on your toes.
Okay.
Now walk back on your heels. Now back to the window on the lateral aspect of your feet. And then best you can back on the medial aspect of your feet. Alright, very good. I'll have you sit back down now. So now what I'm going to do is we're going to test dorsiflexion, plantar flexion. So I'm going to have you bring your toes with your dorsiflexion first. Bring your toes kind of up towards you like this. Now down like you're pressing on a gas pedal. No. Alright, very good. Any issues with that? Any pain or discomfort?
No.
Okay. Now we're going to do inversion, eversion of the ankle. Any pain?
No.
Okay. Very good. So now I'm going to go towards a couple more of our special tests. Since I just did inversion, eversion of the ankle, I suppose we'll stick with the ankle area. So kind of would do a test for ligament injury of the ankle, the anterior drawer, posterior drawer test. So what I'm going to do is I'm going to put my hand kind of on distal tibia, foot force there, essentially stabilizing it. Grab the calcaneus and see if I can bring it forward, which would be anterior drawer positive if I was able to, and then push back with the posterior drawer test. And then while I'm doing this to the patient, best you can just let her know not to flex muscle or anything, kind of let this be as natural as possible. And I'm not able to really move around her ankle, so I would do those would be negative tests. So kind of working our way back up to the knee, we're going to do the McMurray test. So what I'm going to have you do, Lindsay, so the knees are kind of flexed right now, but I think I'll probably have you lay back into a supine position. I'm sorry, I keep having you move all the way around in all kinds of different areas.
That's okay.
Okay. So knees are flexed, I'm going to bring it up. Okay. And then we're going to rotate your foot out. And while I'm doing this, I would have my fingers kind of laterally and medially to see if I could hear any audible popping or clicking, or if I could palpate any audible popping or clicking, which I did not on the right leg. And I'll do the opposite, the left leg. Okay. And once again, no audible popping or clicking, and I was not able to palpate any popping or clicking at that time as well. Okay, so then I'll have you come back up to a sitting position, Andy. So then we'll do the anterior posterior drawer test for the knees. Wanted to have you sit up for this so I could get a better view for the camera, but maybe lay back down again in the supine position.
Okay.
Just so our knee reflex or stabilize a little bit better. Try to keep it down usually too. And I'm just going to see if I can move your knee, move your foot your leg forward. Not necessarily do that anteriorly. Push back posteriorly. I'm not able to either. Something with the opposite leg. Okay. And then with that test, I'm not able to move that either. I believe that gets us through our assessment, Lindsay. I didn't notice any abnormalities in your assessment. Do you have any questions at this time?
No.
Alrighty, thank you for your time this morning.
Thank you.